Welcome back to the Arise interview, where we speak to the newsmakers as well as ordinary people doing extraordinary things around the world and featuring the voices at the heart of the stories. I'm Charles Anyegolo. Now, Nigeria has taken delivery of its first batch of COVID-19 vaccines through the global Covax program. It's an international United Nations scheme to immunize people in developing countries against the coronavirus disease. So, with 4 million doses of the Astra Zeneca vaccine now in Nigeria, the country is preparing for a mass rollout across its 6 regions, and health agencies are calling on people to register online so they can get inoculated. Priority is, of course, being given to frontline health workers and to those with underlying health conditions. But there's a lot of skepticism about the vaccination drive.
We've worked so hard to get the vaccines here, but there's even more hard work that begins right after these vaccines have been certified as good enough for Nigerians by NAFDAC. So right after NAFDAC collects samples and certifies that we should use these vaccines, then we'll have to work with the states, the local government areas to make sure that all eligible Nigerians get the vaccines.
Well, for more on this, I'm joined now in the studio by the molecular virologist and epidemiologist, Dr. Akyala Ishaku, who is a senior lecturer in the Department of Microbiology at the Nasarawa State University in Kefi. He also does work with all the relevant groups and organizations here in Nigeria. Thank you very much indeed for joining us.
Thank you for having me.
What do you think the response will be? Because there's a lot of skepticism around vaccines, isn't there?
Actually, there has been a lot of misinformation about COVID vaccine around the world, most especially in sub-Saharan Africa, because it comes with a lot of myth. It comes with a lot of, which is associated with misinformation and fake news. So the vaccine uptake is not going to be optimal as expected. This is because of sheer beliefs and sentiment. What the government needs to do more is to engage public-private partnership with media organizations like yours to actually give the proper information and counter misinformation and fake news. So we need to do a lot of what is referred to as mass advocacy in terms of vaccine delivery and vaccination immunization programs. So
well, do you think it's up to the government? Because, I mean, you know, the government's done a lot, let's face it, because up till now, beyond the skepticism around the vaccination of people, the vaccine itself, I mean, a lot of people don't even believe that there is anything called COVID-19, in spite of the fact that the government set up a presidential task force, has been holding briefings, media houses have done so much, still a lot of people don't even believe it exists.
Yeah, absolutely. A lot of people do not believe that there is even COVID. A lot of people do not even believe that uptake of COVID vaccine is something worthwhile. This is because we do a top-bottom approach. And actually, we don't have a feedback mechanism from bottom-top approach. So we need to actually engage into research to actually see whether people at the grassroots level, at the rural level, actually this information gets to them.
Right, okay, well, let's talk about the logistics, because, I mean, you know, these are slightly broader things. I mean, the vaccines have arrived, there's, you know, 4 million doses of them. Do you think that the e-registration, because that's how they're planning to get people to do it, might cause challenges with equity in the administration of this vaccine to people, especially people who live in sort of hard to reach areas where there's no internet to help them register? And of course, health workers in very remote areas as well. I mean, how will those people be reached?
Yeah, absolutely. The federal the presidential task force and the Federal Ministry of Health with the National Primary Health Care developed a homegrown strategy called the immunise, that is electronic immunization management data system. It is a platform that is used in developed world, and so it is also deployed here, you can actually register online. So the question arises, I've been involved in polio vaccine immunization program, and actually I agree with you there are places that are hard to reach. There are no...
Well, there are places that don't have the internet.
Absolutely.
So how are they going to e-register?
So, yeah. So that poses a challenge, but actually some of the softwares, you can actually register on them offline, and then they get into uploaded into the central database. There is what is referred to as the OD key that we used in polio vaccines. Actually, you can use it offline. So issues of internet accessibility has been handled by this platform.
And so you feel confident, based on your experience, past experience, that they'll be able to pull it off?
Yeah, I feel confident that Nigeria is on the right track, but my worry is this, that we have not gotten the required number of doses to actually establish herd immunity. You will agree with me that we're a country of 200 and above million people, and we just have only 4 million. My worry also is that...
well, obviously 4 million is the first batch.
At the first batch. And you know that this is vaccine that you give the first dose and the second dose. So invariably, we are vaccinating 2 million people.
Right.
Now. So my worry again is that we also have a circulating mutated variants in Nigeria. So will this vaccine actually work against this?
Well, I mean, you have to start from somewhere, don't you? Absolutely. I mean, you know, you have to start from somewhere and then deal with it as those mutations. Because first of all, you've got to be aware.
Absolutely.
That there are mutations and where those mutations are before you then start talking about a solution for them.
Of course, it has been established that we have mutations in Nigeria, and I think we need to also learn from the South African experience. They also have a variant, a mutated variant in South Africa, and so when they deployed this vaccine during clinical trials, they discovered Astra Zeneca. They discovered that the efficacy is not, optimal in nature, so they have to withdraw it. It is time for us now to be at the global scientific stage to actually discuss this epidemiological data. So I want to advise the Presidential Task Force and the CACOVI to actually set up a research consortium to actually look into this immunization program. We can actually have a baseline for people that are immunized. Take their blood, check for the antibody titer, make sure that they don't even have the COVID.
But that's what, I mean, they're already doing that. I mean, that's what the CDC, that you have some affiliation with, that's what they did a big antibody thing with 10,000 people recently across Nigeria, a big study.
Absolutely. It was a big study. It was done in Lagos, Nasarawa State, Enugu, and Gombe State.
Yes.
It was actually a big study, but we are talking, the study is not vaccination immunization program.
I mean, you need several different studies.
Absolutely. So once we vaccinate like 2 million people, after 3 weeks, we need to take their blood sample to actually check whether their immune has responded.
That's a good point.
Yeah, to
now,
the vaccine.
Let's talk about the other issue, which is cold chain systems, because that is what is required for this vaccine to be preserved.
Absolutely.
How is Nigeria set up for that? We know there is a probably central cold store at the national level, but what about at the state and zonal and local government and ward levels? I mean, do they have cold stores? Are they set up to deal with this?
Yes, they are set up to do. We have all the cold chain system storage facility at state and also at local government level. This is because we have been involved in a lot of vaccination immunization program, and this vaccine in particular is stored within the temperature of 2 to 8. And most of our vaccines, the child preventable vaccines that we use in immunization program in Nigeria are also stored within the same temperature.
Right, so you're saying that at the very lowest level, they have the capacity
we have the capacity to actually store that. The good news is that Gavi is also installing some solar panel systems at different rural areas to actually support the electricity shortage.
You're saying they're installing.
Yes.
So they haven't actually installed.
Yeah, no, not.
They're in the process of installing.
But actually we have platforms that we can be able to store these vaccines at the temperature of 2 to 8.
Right, and obviously the reason why we take what you say on board, and it's quite important, is that you straddle both fences. In other words, you do work with the government, but you're also in the private sector to some extent. So your assessment is very important and is considered to be objective.
Okay.
Right, and not influenced with a gun to your head approach
that
some people in the government departments might have. And so at the national level, Nigeria, is that your assessment that Nigeria presently has enough cold storage room to accommodate 4 million doses of these vaccines?
Absolutely, it has that capacity. And again, you will hear overheard the Executive Secretary of the National Primary Healthcare, Dr. Faisal Shaibu, when he received the vaccine today, he said that there will also be collaboration with some public-private partnerships, sort kind of, and also the COVID platform. Also, they have deployed some logistics system that will also help the presidential task force and the federal.
Well, it's very interesting that you say the things that you do, and I have no reason to doubt you. I mean, obviously, that what you're saying gives room for optimism.
Absolutely.
But I also heard earlier in the day one of the state ministries, state sort of health departments, talking about the challenge and saying that the challenge will be in moving the vaccines from the national to the state, to the local government and to the ward levels, because that most of them don't have functional cold storage equipment. And obviously if the storage is poor, then it becomes virtually impossible to have access to the vaccines.
So the question we should ask the state ministry is that, how do they store their vaccines for the routine immunization? What happens to the cold chain system that are being used for the storage of vaccines for the routine immunization? So a lot of states have platforms. And I think one of the things that we need to actually, the Nigerian Presidential Task Force needs to talk to the Nigerian Governors Forum is the ownership of the fight of this pandemic. Actually, I agree that not all states have actually taken the ownership to fight this pandemic, which is quite key. And I think some states like Lagos are excellently doing well. I just look, I was part of an online virtual review platform. Lagos State has earmarked even private centers, private hospitals. They have gone into public-private partnership and where people can be able to get these vaccines. In fact, centers have been earmarked and even uploaded in Google Maps. So as you begin to drive, you just get a Google alert that there is a center for you to take vaccines. So, but not all states have actually taken ownership of this. And
so that's going to be a challenge.
Yeah, so it's going to be a challenge. So we need the political will to actually drive this process of COVID immunization.
And of course, 4 million vaccines so far in a country, as you said at the outset, of 200 million people. So quite a way to go yet.
Absolutely. So that brings to the national question. Do we have the capacity to actually deploy or produce these vaccines locally? So I will add my voice that it is quite key. What the PTF and the CAC...
Well, you have to, first of all, you have to have the people who own the patent have to be able to allow you to be able to develop it.
Absolutely.
I mean, they have to license you to be able to do
the Oxford Zeneca, it's been manufactured
in India.
In India,
yeah, but those people are known for doing that internationally.
Absolutely,
and you're not known for doing that internationally in Nigeria.
We lost it in 1991. Nigeria was producing yellow fever vaccine as far back as 1967. We had a WHO certification towards that. We are producing yellow fever vaccines and measles vaccine for the West African sub-region. We lost it in 1991. So what we just need to do is to have a presidential initiative.
Okay, well, that has to be a discussion for another day. I have to say, Dr. Akyala Ishaku, it's been a pleasure having you here. Thank you very much.
Thanks for having me.
You're watching The Arise interview. Plenty more still ahead, including as regional leaders condemn the violent crackdown by Myanmar's coup leaders. Security forces again used tear gas and stun grenades against protesters in the biggest city, Yangon. Stay with us.